Welcome. First of all, just apologies for being 5 minutes late. I think it's the first time in several months that we've been late. It's entirely my fault. I managed to come off my bike on my way here, so my thanks to members of the public who stopped, and in particular Bev, who managed to get me here on time in a scene that felt like the opening scene of Four Weddings and a Funeral, but without the bad language. We have all recognised, of course, that good communication has been the key to our success so far as a community in managing COVID-19. And we, of course, have always been, or tried certainly, to be open, honest, quick and frequent in all our communication, not least to scotch any misleading rumours circulating on social media or in the community. So I must begin by saying that this is the last planned briefing before the general election on the 7th of October. We know that that's not ideal, but although we do not have in Guernsey any formal PERDA rules during the election period, as both Heidi and I will be candidates, we have decided that we will not plan to hold any briefings during the election period. We will only do so if there is a development or new information that requires a briefing to be held. And so in that sense, I guess you can say that, that no news is good news. The purpose of today's briefing is to update you on progress towards Phase 5C and to explain in more detail how this phase will work. And Deputy Salisbury and Dr. Brink will take you through this in more detail in a few minutes. We know that a move to Phase 5C does increase the risks of COVID-19 returning to our bailiwick. And of course it is worth repeating once again that elimination of the virus was never part of our strategy. The fact that we've managed to do so, and do so well for of course well over 100 days now, is fantastic. But it is frankly a byproduct of our strategy, and has been the ability, of course, as has the consequent ability of our community, economy and education systems to return to their pre-COVID operating norms. And the fact that everyone has the confidence to go anywhere and do anything, which of course is not the case elsewhere without face masks or social distancing, is immensely valuable. Being COVID-free has given us a level of confidence as a community and the well-being for the whole community, which is almost as valuable as being COVID-free itself. And it's that trade-off that has to now be taken into account in any decisions that we now make. We have to judge the impact of the risk of the loss of confidence amongst our community and its potential economic and social impact if that were to happen. And that's what I think makes our decision-making different from other jurisdictions. Other places are not making the same decisions from the same point of advantage that we are. And arguably, I think this makes it harder for us to make the right judgments at the right time. And of course, it's a nice problem to have, but it is a challenge. Phase 5C will make travel much easier and much more viable for most travellers. Those travelling from Group B countries will need to observe only a very short self-isolation period to allow for the test results on entry at the ports to be processed, provided, of course, those tests return negative. We've set a very tight deadline for the public service to design and deliver a model for Phase 5C that is ready to go as and when the CCA decides that it is right to make the change. And that work is nearly complete. But it is frankly a very big but, the CCA has not yet decided to make that move and has not set any date as to when that should happen. The construction of the facilities at the harbour and airport will be completed by the 7th of September. New equipment is being sourced to increase our capacity, our on-island capacity and testing capability to a potential of more than 2,000 tests a day, and additional skilled staff are now being recruited while others are undergoing training to upskill in this area. The new equipment that we needed, and Nikki's talked about before, was ordered in July, but the manufacturer in Australia has now advised us of a delay to its arrival in Guernsey, which is expected to be in the last week of September. And this will, of course, be followed, as it was earlier in the year, by a short process of commissioning and testing the new equipment before it can be used in practice. Therefore, there can currently be no move to Phase 5C before the end of September, and the CCA will endeavour to give at least 1 week's notice ahead of any change, so that transport operators and the community can plan appropriately. A couple of other quick points from me in terms of consequences. Firstly, costs. We estimate that the one-off capital costs of the testing facilities and equipment will be around £600,000. The ongoing costs of a 5C testing regime and programme for travellers is estimated at 3.7 million for 6 months. And in light of this, obviously substantial sums of money, it is incumbent on us to give full and proper consideration to any charging strategy, and that is being considered. Secondly, car parking. There will be a temporary loss of 49 car parking spaces on the east arm of the harbour during the construction of the facilities there, which will begin next week. And when, and as I said, finish by the 7th of September, and when operational, there will be a loss of between 107 on a normal day when a boat is in, and 175 spaces on a busy day on the East Arm. And the team are looking at whether and where alternative parking provision could be made. And finally, from me, given that the general election and of course all that will follow from that, this may well be the last time that I speak as the chair of the Civil Contingencies Authority. It has been the most enormous privilege for me to serve this year in this role and to lead the most amazing team that has served the bailiwick so well. The spirit, camaraderie and teamwork that has been embodied by the whole community, really, pulling together as one, of course, under the banner of Guernsey Together, I think really has been an enormously uplifting and positive experience for so many in what has obviously otherwise been a very dark period. So thank you very much from me, and over to Heidi and Nikki.
Thanks, Gavin. I'd just like to echo, as President Committee for Health and Social Care, the comments that Gavin's just made. It's certainly an experience that I'll never forget, and I would just like to thank everybody out there for having followed and listened to us over these last few months, and very much for the support you've given. It's been so appreciated, and yes, it's been a very different world this year, but I really have been proud of what people of Guernsey have achieved. So moving on. As you may have heard, we released the first report on the findings from the community survey this week. I'd really like to thank everybody who contributed. We had just under 3,700 people who submitted their forms. I do believe Mr. Soulsby did in the end as well. So I think it was like 3,699. So if only we could have just got up to that 3,700. But anyway, that's what we had, which is an amazing response in terms of whatever we do throughout the states of Guernsey. We never get such a fantastic response as that. So it was really, we've got really good data from which to work in the future and learn from what people's experiences were and what we need to do about that, either if something else happens on similar lines or what we need to do following lockdown and where extra help might be needed, for example. So it was pleasing to see that 83% of respondents thought that the lockdown restrictions were fair and justified. And that was good. I mean, we're pleased about that. But what also came out of the survey was that 48% of people who responded to the question thought a second wave and or second lockdown is our biggest threat. Whereas on the other side, a lower percentage, 10%, but it was 10% of respondents said that they thought the biggest threat was our isolation, living in our bubble. And this reflects the tension that exists there and what we're dealing with at the moment. How do we make sure that we can move through the restrictions we've got safely and securely? How can we open up our borders, or rather make it easier to cross our borders without putting our community at unnecessary risk? And by that I don't mean letting the virus in, because our aim was never to not have the virus. It's because of the community's fantastic effort we don't have any known cases on the island now, but it's how do we make sure that we don't end up with an uncontrolled spread of infection. So that's what we've been looking at ever since we've gone into phase 5, and I know Nikki's team been looking at it since before then. So a lot of time and effort has gone into it. Now, we've already moved from the mandatory 14-day self-isolation as we've gone to 5B, and now we've been looking at how we ease restrictions even more into 5C. So Dr. Brink and I are going to have our last ever double act, and we'll be going through what 5C means. So this is just to give you a bit of for those people who don't know, but just to recap, this is what 5B looks at the moment. So we've got 3 group countries. Group A, where anybody who's come back from the Group A countries needs to self-isolate for 14 days. So one of those would be the United States of America. Then we've got Group B countries, where people can have a test on day 7, self-isolation before then, and they can have passive follow-up for the next 7 days. And then we have the Group C countries, which are, at the moment, Isle of Man, those countries where we've got an air bridge. So we distinguish between Group A and Group B by the prevalence in that country. So where we're looking at over 30 cases per 100,000, that would be a Group A country. And so Group B countries are under 30 cases per 100,000. Now, we don't go immediately from Group B, a country won't go immediately from Group B to Group A. We put, if it looks like a country has gone over those 30 cases per 100,000, we put them on a watch list and watch them for 7 days. And if that continues for 7 days, they go to Group A. And there might be other indications as well in terms of what public health are concerned about, certain things that are going on there, whether the testing rates aren't high enough and things like that. And that's where the public health team are looking every day at those countries to make sure we've got the list. So anybody thinking about going away, please look at the gov.gg website, make sure that you know where the country sits at the moment in terms of what group it's in and whether it's on a watch list, because it might change. Now, so far we've had 463 patients tested since 17th of August, and we've taken, or Public Health have taken samples of 30% of those. And the swab, the time it's taken from getting the swab to the result is 9 hours. I think it's an absolutely fantastic job by the whole team there. That's from the sampling team to the testing team and the public health results team have meant that we can get results out within 9 hours. Now, we say between 24 and 48 hours because we don't want to overpromise and under-deliver, but to date, that has been the speed at which the testing's been undertaken. So well done to the whole team, everybody involved in getting that done.
Right, okay. So just before we go on and talk about the mapping of Phase 5C, I thought it would be useful just to remind you of this graph, of this diagram. And I'm afraid you've all seen it before, but I think it does illustrate a point as to why we've decided on a 2-point testing plan. So if you look at scenario 1, that is the traveller that is infected prior to travel. And you can see if you test that person on the border, at the border, they will likely to be positive. So on day of arrival testing, people that are infected prior to travel will indeed be positive for the virus that causes COVID-19. However, we have a second scenario, and that is the person that is infected during travel. So either in the day or so immediately prior to travel and during travel. Those people, if you test them on arrival, as you can see in scenario 2, they in fact will be negative for the virus that causes COVID-19. So it's that evidence that has led us to design our 2-point testing strategy in phase 5C. So we always backtrack onto what is the biology of this virus, what evidence do we have on when the virus is transmitted. So that forms the basis of the scientific evidence for the recommendation. And with the move to phase 5C, what we are doing is we're keeping Group A, B, and C countries, because that means the external risk is a quantified risk that the population of the bailiwick are familiar with. So again, that will retain the above 30 per 100,000 for Group A countries, the below 30 per 100,000 for Group B countries, and then Group C countries are countries that we have an air bridge with. So with Group A countries, we are still asking them to self-isolate for a period of 14 days. These are countries with a high prevalence of infection, and we need to be cognizant of that when we look at travellers coming into the community. But what we will be doing for Group A travellers is be asking them to take a test on arrival. Now, the reason why we're asking them to take a test on arrival, I think some of them would like to know whether they've got the virus, but also importantly, if one of them does test positive, we would then go and contact trace, for example, on the aeroplane, people sitting in the same vicinity on the aeroplane. So it all goes back to our fundamental test, track and trace system, the early detection, the early diagnosis, and that prevention of onward transmission. So important when we look at our strategy. So I think phase 5C, were you going to discuss some of that?
I think this is where we've broken down here, Nikki. It was going to be
Right, fine.
I'm happy to.
So with phase 5C, when we talk about the Group B countries, is we then look at someone coming in to our ports and harbours, and what they'll be then having is a supervised self-swab on arrival. So we'll have the swabbing booths, and people will go in and they'll take a swab themselves. Now this is really important. We've looked at this in great detail, and there's going to be videos for people to look at prior to travel. There'll be leaflets for people to look at, and indeed there'll be people there supervising the whole swabbing process. So that'll happen at the ports and harbours, and that'll allow us to process 1,000 or so passengers coming into the island on a daily basis. And when we designed this program, we really wanted to make sure that we had a sustainable program that would last us for months. So what will then happen is after someone taking this, has taken the swab, it'll go to the laboratory and they will stay in self-isolation until they get a negative result. And again, what we're looking here is not at risk elimination, we're looking at risk reduction. So we're looking at trying to reduce the chance of infection. Well, then the person, if they get a negative result at the end of, on their day of arrival test, we'll be asking them to then have, or we'll be requiring them to have a second sample on day 7. That's to control for the travel-associated infections. But between the negative result on arrival and the swabbing on day 7, people can go on with their business, so they go into what we call passive follow-up. So the only restrictions we're putting them there is not visiting hospitals, not visiting care homes and so on without prior arrangements. Now the reason why we're doing the day 7 swab is we obviously want to detect any travel-associated infections, including those that are asymptomatic, about 40% of cases, and the mildly symptomatic people, but we also then want to be able to do contact tracing. So we're looking again at that risk mitigation, limiting the ongoing transmission of virus in our community, so that test, track and trace. And then, as I said, they will remain in passive follow-up until day 14. In passive follow-up, people can go about their business. They can go to work as long as they're not working with vulnerable people. If they're a healthcare professional, there'll be specific measures for those individuals. But other than not visiting care homes, hospitals and so on without prior arrangement, and keeping a sensible record of where they've travelled and adhering to good hand hygiene and respiratory etiquette, washing their hands, staying at home if they're unwell. So good practice, which in fact our entire community should be doing. So it'll fundamentally change the process for people, for travellers coming into the bailiwick.
I think, as Nikki has just said, we will be setting up testing booths, both at the port terminals, so at the harbour and the airport, and a lot of work has been done on that, and a lot of credit to all the guys behind the scenes who have making that happen. I think people will have seen, anybody going through the airport would have seen the work going on there, and the work's happening at the harbour as well. It's been a huge effort, but absolutely amazing. I'm really a lot of credit for the people who have done that. New equipment, Gavin referenced this in his opening speech. Yes, the order's placed, but it is being delayed through the manufacturer, but hopefully we'll be getting that by the end of September, and we'll be able to start testing the equipment and make sure everything's in place by then. We're doing it this way. I know other people say, well, other countries have got a testing capacity. They can test lots and lots of people. But here we're trying to build reliability and resilience on island. So we're not doing this as a one-off. We're building up the expertise on island. So we've got the people who know what to do when we need it. We've got a really excellent public health team who have really stepped up to the plate, as everybody knows the amount of work they've done there. And we want to build on that and make sure that we've got the experience on island and we're not dependent on anybody else. And so, Nikki, would you like to say more on that?
I think what's important is we've looked at upskilling local people to do these jobs, and it's been really, really important. So, for example, a lot of our laboratory staff now have considerable molecular experience. So it's a case of developing staff to provide us with a resilient and sustainable solution. So as we move to our winter season, because we've developed our own in-house assay for COVID-19, what we'll be doing is looking to what we call multiplex. So we're looking to add influenza in, so we can have a single sample to do both an influenza and a COVID-19 diagnosis. So it's all about continually pushing forward and looking at how we can improve things. I think also what's important with the robot is that we'll increase our testing capacity to between 2,000 and 3,000, so hugely increase our daily testing capacity, which will be really beneficial if we want to do the two-step testing program on day of arrival and day 7. The other thing that we've looked at is we've asked people what they're interested in. So a lot of people have said, oh, I've read about a 2-hour test and so on. What our islanders are interested in is what the time is from someone taking the sample from them to them getting the result. And that's really important. So if you speak to islanders, they want to know, after I've had my swab, when do I get my result? So instead of talking about, well, the test takes this long, we're actually talking about a swab to result time. And that's how we're measuring our performance. So I think that's really important because that's what matters to islanders. When can I have my result? So I know whether there's further action because I'm positive, or whether I can go about my business essentially because I'm found to be negative. So I think, again, it's designing programs that our islanders want, and I think that's really important. So if we look moving into phase 5C, it's all about mitigating the risk. So the safest thing we can do is to get everyone to stay in self-isolation for 14 days after returning to the island, when we know that's not sustainable in the long term. So what we're doing now is we're looking at mitigating all of the risks associated with infection. So the self-isolation until we get the first result, again, just takes one time of transmission out of the equation. So if someone is positive on arrival, yes, we'd go back and contact trace the aeroplane, but we'd have no further contacts after arrival into Guernsey to contact trace. So that's really important. So the day 7 test will allow us to check cases that have been infected during transit. Now, as the airports get busier, this may become riskier. However, linked to that is people are getting much better about social distancing, masks, hand hygiene and so on within the airport. But we think it's reasonable to put that day 7 in to look for that infection during travel. So the other thing that we are asking people to really have is a very low threshold to come forward for testing if they're symptomatic. We know that 80% of people with COVID-19 will have a mild infection, and some of them will have very few symptoms. And I think it's important that these people do come forward and be tested, because what's a mild infection for one person is not necessarily a mild infection for someone who's over 80, who has underlying medical conditions and so on. And I think that's really important as well. I mentioned earlier that our on-island testing capacity will increase to over 2,000 a day, and that really is important, and that is a sustainable long-term solution with the equipment that we've purchased and we now own, and the upskilling of our staff, really important. And the other thing that we've been doing within the contact tracing team is they've been reviewing all the procedures and protocols. We're always looking to do better. We're always looking to push things further. So they've re-looked at all of the contact tracing programs and protocols and tweak things that we thought, well, maybe we can change that slightly to make such and such go smoother. So all of that has been happening over the last month. Now, what we're also asking is during the time that people are in passive follow-up, what we are saying is, could you please keep a list of where you've been? And that's really simple. I've been to X place on the X day, and it just means that if someone does come up positive, we will go back for 48 hours in the contact tracing process. It just is easier for us than people thinking, well, where was I 2 days ago? We all forget quite quickly. Well, I certainly do. And so I think that's really important. And alongside that, we want to promote a really good message of respiratory etiquette, good hand hygiene, catch it, bin it, kill it. That's ever more important as we move into the winter months, so important. And finally, stay at home if you're unwell. And we're asking employers to please be considerate of this. So a lot of times people might feel slightly unwell, but not so unwell that they can't work. So what we're asking is that people could stay at home and try and facilitate working at home under those circumstances. So again, it's that Guernsey Together community approach to let's see, as we move into a period where we're more likely to see the virus return to the island and possibly more likely to see transmissions, let's look at what risk mitigation and risk reduction that we can do. And then my final thing I wanted to do is to thank everyone who had COVID-19 in our first wave. For those of you who have completed the survey, it's providing us with a very, very rich source of information. So we're not only looking at what people's symptoms were when they had COVID, but we're also asking people what their symptoms are now, so if they've had any long-term sequelae of COVID-19. Now, we've had about 140 returns as well already, which is fantastic, but although we said the survey was going to close, I think a couple of days ago, if anyone hasn't completed their survey and did have COVID-19, please do complete the survey. This is informing not only should we need to deal with further cases on the island, but also whether there are any health and care facilities, allowances that we need to make for people who did have COVID-19 in the first wave. So if you could send those in, that would be really great. So thank you very much.
I'll just finish. Thank you, Nikki. So that's 5C, and that's what 5C will look like. As we said, we haven't got a date for 5C, but we think it's important, as we have been doing throughout the whole of the last few months, is be open and transparent, and when we have information, we'll let you see it. And so that's why we thought we needed to show you what 5C would look like now, understand while there's work's going on around the island to make that happen. As soon as we can go to 5C, we will, and we will let you know.
Great, thank you very much. Before we go to questions, Nikki, just one quick question from me. You've explained that anybody who has any symptoms should operate at a low threshold, and they'll come and be tested. The test that they will have will not be a supervised self-test, will it? And would you just mind speaking to that a little bit about the difference between surveillance testing and symptomatic testing, and why there is a different test process at the borders versus for those people who are symptomatic?
Absolutely. So surveillance testing is what we're doing at the borders, and the self-taken swab is slightly less sensitive than an operator-dependent swab, so a swab taken by a healthcare professional, about 10% less sensitive. But what we do know about self-taken swabs, it will detect people that have high levels of virus, so it'll detect people that are most likely to transmit infection in the community. So that's really important from that. So to be able to sustain high volumes of individuals coming through our ports and harbours, which is what this programme is designed to do, this enables us to do it with a supervised self-taken swab. That is completely different to someone who is symptomatic. So someone who is symptomatic will continue to go up to the tent by the pathology services and have a swab taken by one of our nurses or healthcare professionals working within that centre. So that's really important, because if you're looking at someone who's symptomatic, is what can happen is someone can be symptomatic and they can actually lose their virus quite quickly. And we want to get a diagnosis on them. So it's really important that we do all we can to get an accurate diagnosis. So the one program is surveillance and risk reduction, and the other is a diagnostic program looking at finding a specific cause for that person's symptoms.
Yeah, I would just add that, as Gavin referenced, we're looking at the possibility of charging for the border testing. That will not be the case for symptomatic testing. Absolutely, that will be free. People will be able to have that test, and they shouldn't ever think of that as being a reason why that they shouldn't get tested. We want people, the slightest symptoms, it's going to be really important that people do get tested as we go to 5C.
Good. Thank you very much for making that point. Okay, we'll open up to questions then. Who'd like to go first? Yes.
Hi, Marina Jenkins, Channel TV. Just with this self-swabbing then, how confident are you that this is the best way to go about doing it in terms of, relying on general public to do it? I know it is supervised, but is it simple? Is it something that you think, yes, this is absolutely right for us?
So the evidence that we've got is that people manage to take self-swabs in other jurisdictions. We've looked at the Australian experience. We've looked at some of the experience in the UK. So what we're looking at is a program that enables us to facilitate the broad opening of our borders. So that's what we want to do. We want to be able to enable people to come through the borders but have that risk mitigation. So if you're looking at the risk associated with that, you'll get about a 10% reduction in sensitivity. However, if someone is highly infectious, it is very likely that you would detect the virus. People won't be able to waive the swab and not take a swab, because there will be people in the tent that will be supervising the process. If someone says, look, really, I can't do this, I just can't do it, or for example, another example is someone's had surgery to their face and feels that they're unable to, what they will then do is they'll get an operator taken swab, they'll get an appointment made for them to go up to the hospital. So it'll be self-taken swab, supervised, but if you can't do it, we will make alternative arrangements.
Yeah, that's a really good question. It was a question that we asked of Nikki. Even the biggest thing that, so, well, what about self-testing? Some people say, oh, it doesn't work. Nikki gave that explanation and more, and we're comfortable with the approach being taken.
Okay, thank you. Next question.
Ewan Duncan from BBC Guernsey. Just a quick word, Deputy Salisbury, about the potential cost of charging for these tests. Obviously, it's up to an individual if they decide to leave the island and come back again, but what roughly can you expect to pay for a test of this type?
Well, that's something we'll say when we get nearer the time. There are very different scenarios, but we will also be guided by the State of Guernsey's principles in terms of charging as well. We have to think about that and what we consider as something that is right for the purposes, weighing up the different risks and why we need to do it. So it's not straightforward, but there isn't the final answer at the moment. And that's why, because we've got to say, well, what would be the right cost for what we're asking people to do.
Do you think this might deter people from wanting to travel, though?
Well, you don't know until you know what the cost is, I suppose. But I mean, it's you're going to have to think, well, if somebody wants to go away, they'll have to think about that cost as a whole, and the cost of getting off island, staying wherever they are. So that people will just need to think about the cost as a whole, or whether it makes it affordable or not. Those are part of the things that we are considering when we decide A, whether we charge, and B, if we do charge, what that charging amount, that level will be.
The fact is that the response to this event produces a lot of kind of trade-offs, and another example is the impact on car parking, for example. In order to facilitate greater travel through the port, we have to create the space to enable those testing facilities, which means that there will be fewer parking spaces, long-term parking spaces on the East Arm, that then we try and compensate for. So there will be a whole bunch of people who will be impacted by that change who may not be planning on travelling on a boat for months or years. And these are the kind of trade-offs that we have as a community. We have to make those decisions, and that ultimately becomes a political decision, as does the question of charging, because it's the reality is there are, as we know, substantial financial costs that have arisen out of this whole experience. And as we go forward, we've got to think about where it is reasonable for that burden to rest. Does it rest entirely on taxpayers? Does it rest entirely with the travellers? Is there a fair share between the two? Those are and ultimately those are political decisions that do require some thought, and they require a trade-off, and it's a balance, and it's not an easy scientific answer could be given to that question. Helen.
I'm just quite surprised that charging is even being considered, because the tourist industry has been sort of crippled by this year, and I imagine they're going to see this as a kick in the teeth when they're down.
Well, as I said, I think charging does exist in other jurisdictions. It as a responsible government that is spending taxpayers' money, we have to consider where the fair burden should rest. Now, no decisions have been made on all of that. We do need to think about a charging structure and a charging policy and a charging strategy, if you like. At the moment, some people will already be, some of those who Nikki and her team and the pathology team will be providing tests for those that have a commercial need for it, will be paying a charge, for example. So that has to be considered as well as getting the right balance. So I understand exactly the nature of the question, but as Heidi has said, these are we've got to think about a range of interests rather than just one narrow interest. Yes, sorry, I can't see you through the light, but
it's Maisie.
Oh, hi, Maisie. Hi.
Express. Dr. Brink, I know you did touch on this, but in a previous briefing, you did say you spoke against on-arrival testing being right for Guernsey at that time because of the risk it brought. Why do you think Guernsey is ready for this risk now?
So the reason why we didn't do on-arrival testing before, because we had a self-isolation programme. So we've always said that we'd look at it as a whole risk approach. So when we had 7 and 14 days isolation, there's no need to test on arrival because people are going into isolation. Now we're looking at a quarantine or a very, very dramatic reduction in the amount of self-isolation. So for that reason we do testing on arrival to detect those people, and I've always shown the same diagram of the pre-travel and the travel-associated infections. So again, you look at your isolation policy and your testing policy, you don't do them separately, the two have got to sit together. So the moment we reduced self-isolation is we had to put a point of testing on arrival, and that's to detect the pre-travel infections. So we've got a point to detect the pre-travel infections and a point to detect the travel-associated infections. So that's why we've just designed the two-pronged approach, so to speak.
And also having this is predicated on having really beefed up testing capacity and being able to do about 2,000 tests, which we don't have at the moment.
Okay, next question.
Question for you, Dr. Brink. What triggers are we having to see until we can think about moving to 5C, which, as you've all said, we don't know when that'll be at this point?
So we've set our country-associated triggers, and we've been very clear about the definition of those. So we've set a slightly more generous of 30 per 100,000, and we've also put in our watch list in the Group Bs. We're also looking, for example, at testing rates, because if you don't test, you won't get. And we have another category when we look at it to see if there are any public health concern. So that's been set. The equipment's ordered, so obviously the equipment needs to arrive on Ireland, but essentially the decision to move to Phase 5C is not a public health decision, it's a decision for the CCA.
And by the time we get all the testing facilities on Ireland and get everything set up, it's looking like the end of September, so realistically we're looking probably into October before we can think about 5C, is that correct?
think, Carl?
Yeah, well, as I say, we're waiting for the equipment. We expect it in the last week of September. That will take a week to make sure we've got all the processes working. So we'll have to have run-throughs, make sure people understand the equipment and know how that works, but also make sure we've got processes working at the borders right. The information's coming through. We've got the app that's been developed, and we'll be dependent on making sure that the information's coming from the borders is going to public health and whoever else needs it. So all that testing will need to be undertaken, which will probably be a minimum of a week, I suspect. So it'll be after then. So we can't say particularly when until we've got the equipment and we make sure that we're all right from then. But it will probably be looking at October, yeah.
Next question. Yes.
If you've got someone travelling in from a low prevalence area, but they've been, in the previous 2 weeks leading up to that, they've been in hotspots, how are you looking at that in terms of mitigating the risk there?
Yeah, Nikki.
Okay, so it's the travel in the 2 weeks prior to you coming to Guernsey. If you've been in a Group A country, we would count that. But so say, for example, you were in a Group A country and then you went into a Group B country and you spent a week in England before you came back here. We would count the 2 weeks from back in England. So we would count back. I don't know if I'm making myself very clear, but we always try and make it as favourable as possible to the traveller. So for example, at the moment, if someone said to me, I was in a Group B country 13 days ago, we could then bring some time, add that on, and allow them to enter a restricted quarantine with a testing program. So we would count back and calculate back and use the most favourable calculation for the traveller. Does that make sense to you? Yeah?
Yes. Is there, in terms of people coming in as well, is there a form that people are going to have to fill so you've got more details?
Yes. Yeah.
And so what does that look like then? You're looking for trust of the public basically to work all this out?
Yes. We'd expect people to fill in the form accurately. It is at the end of the day a declaration, and that declaration will have legal standing. So people will fill in a declaration saying this is where I've been in the last 14 days. So that's really important. But I think we do have to have an element of trust, but linked to that is people are signing a legal declaration. So that's really important. In the future, what we're also going to do is look at regional variations as well. So if you look at England as a whole, there might be areas in lockdown and areas of low prevalence. So we're working on regional variations as well. So all the time we're trying to design something that is most acceptable for the Guernsey population at large, whilst also protecting the community from the risk of infection. So it's that constant tension between trying to do as much as we can but not put the population at risk.
You, and then Helen.
I know a lot of today's press conference is about testing, but if we can turn our attention to other areas that we've not really spoken about today, in particular unemployment rates on the island, which are still very high and obviously impacted by the fact that people can't travel, people can't go away, the businesses that rely on visitors coming to the island and also locals travelling to and from. What comfort can people in that situation, the unemployed or businesses, take from what you're saying today, that realistically, by the time that they can get themselves sorted, we're looking to be early October?
I mean, I think in many ways, certainly in relation to those sectors that have been most affected by the border regime we have had, which of course, as we know, has been the accommodation sector and the travel sectors, really it's a repetition of what we've said many times, is that it's been a very bleak year, and it's not a lot any decisions we've made in the last few weeks or that we make in the next few weeks is not going to substantially change that picture. It is a marginal either improvement or deterioration around what is a pretty grim experience for them, and we know that, and that has been why government has put so much effort and taxpayers' money behind the business support for those sectors, and we've continued to give that commitment that we will continue to keep that under review. We've obviously got this independent assessment now that will help shape the policy to make sure we've made the right decisions. The priority, clearly, for those that are unemployed is that the economy recovers as quickly as possible, and a big element of that is maintaining the confidence and economic activity on Ireland, which clearly we've been able to do since the end of June, and is a significant factor in our thought process as we move forward. But as we've said, there are these competing issues and tensions around the public health issue, around external economic activity, and in particular the ability to bring people into the community. Those that need to go off Ireland to do business as well is another factor. But also we have to take into account the social and mental health and wellbeing issues as well. So there's a whole range of factors that need to be considered.
Is there still concern, though, that when government funding stops to, the sectors that are still currently getting it, we could see unemployment rates rise even further?
I don't really want to get into that kind of speculation at this point. I think it's still a little bit early to be determining what the final outcome is going to be for those sectors. I think there's still a lot, as I'm sure Nikki will confirm, there's still quite a long story to play out with this COVID experience worldwide. How is that going to affect, again, as we've discussed in these briefings before, how is that going to affect the desire to travel in the future? Are more people going to want to travel short haul, or fewer people going to want to travel short haul? Does that mean a brighter or a less bright future for our accommodation sector this time next year or in 2022? And I don't think anybody's got a crystal ball that can answer those questions at this point. So I think it would not be helpful to be speculating on your question. I understand why you asked it, but I don't think I really want to go down there. Helen?
I was just a little bit curious about, you mentioned about testing people who've come back from Group A countries, although they still have to self-isolate for the whole 2 weeks. And I just wondered if it could become a bit of a chink in the armour, because if someone came back from, say, France, which I think is still Group A, and they've got to self-isolate for 2 weeks, but they get a negative test result, they feel fine, there's a bit more temptation to sort of pop out to the shops quickly, things like that.
Yeah.
Are you worried about that, or do you think people will stick to the 2 weeks
we
isolation?
We did think about that, and we did consider that. We have had some breaches in self-isolation, as I'm sure you're all aware. I think the majority of people want to do what's right for the community. I think that is a risk, and it's something we considered, but we also considered the fact that asking people to have a test on arrival and being able to contact trace, say, an aeroplane or ferry that they'd travelled over with, the benefit of that probably outweighed the risk of someone saying, I'm not going to comply and I'm going to nip out. I think most people will comply, but I think there will be some people who don't, and of course we will monitor it, as you know.
I was going to say, I think it comes back to the need to educate and communicate again, and an explanation to that individual that just because they've tested negative on arrival doesn't mean that they will not go on to develop in the next 14 days, and they could be the person who is responsible for bringing it back into the community. And I certainly sense, and I'm sure other people have as well, that one of the strongest experiences is that actually nobody wants to be the person who carries that burden with them, that they've been the one who brought it in. And I think that's why we've generally had a very good compliance with the self-isolation rules, and I'm sure we could expect that to continue. And then obviously, as Nikki has said, the enforcement regime is there. It's there also for false declarations in response to the previous question as well. You have to have something if people won't comply, but I think the experience very much has been that people, as Nikki said, want to do the right thing by the community. Maisie. Sorry, Maisie, did you have another one?
I do.
Yes, sorry.
Deputy St Pierre, I know the Isle of Man Air Bridge is due to come to an end relatively soon. Is that something there are still talks about? And if so, how would the move to Phase 5C affect Guernsey's relationship with the Isle of Man?
Yeah, it's a very good question, and it's one that we've already started the dialogue at both at a political level and at a public health level with the Isle of Man, so they understand our direction of travel in moving to 5C. Ultimately, I think it'll be a commercial decision for the travel operator, and indeed, of course, others who are supportive in the travel industry as to whether there is still a market there going into the autumn, with particularly with schools resuming and so on. At this stage, no firm decisions have been made as to whether it will be continued. I think there's clearly, socially, the experience has been positive, and I think there is a desire to try and do so if it's possible and if there is a market there. But yes, we've always accepted that there is a need, that there needs to be a degree of, well, there needs to be comfort on both sides with the border regimes that both communities have. And that's why we have very regular dialogue at both the political level and at a public health level. I don't know if you wish to add anything to that.
No, I speak to the Director of Public Health regularly in the Isle of Man, as I do speak to Dr. Ivan Muscat in Jersey. I think that talking to everyone is so important. Those links that we have is really important.
Sorry, yes.
Just on Aurigny, obviously operating a heavily reduced service, many staff on furlough. I suppose, how deep are the state's pockets to kind of continue kind of supporting them through this, especially when we still don't have that date yet for when their schedule might increase quite dramatically again?
Yeah, I mean, it's another good question. There are lots of moving parts to the answer to that question as well. There's obviously some of the staff are UK staff, so they'll be benefiting from the UK furlough scheme, which is due to come to an end in due course. The ability for Orkney to do other things with its aircraft until it can fully deploy all its own aircraft back on what would be regarded as its normal schedule, and in particular, going back to the previous question, whether it's in a position to support the Isle of Man in its travel needs in the future. That's another variable that may or may not come to pass. And again, the long-term direction of travel in terms of the size and capacity requirement. So, I think these are all the things that need to be taken into account in determining what role Orkney is going to play, and therefore ultimately what the cost will be to the taxpayer in supporting it. It is a big strategic question. I think certainly up to this point, our ability to be able to rely on our access to Orkney has clearly given us great flexibility in being able to determine the approach we take. But it's a valid question to which I don't have the answers today. Yeah, Ewan and then Helen, and then I think we'll come to a close.
Gosh, which question now then? I was going to ask one about Aurigny, but I feel like we've covered it. Dr. Brink, I was just going to ask you about the 2,000 tests a day. Do you think that's our sort of maximum level on island that we can expect, moving forward now? 2,000, it seems like a good number when you consider 641 got tested in a week of that trial.
Yes. I think it's a reasonable number. We could go higher than that should we need to, but 2,000 is the number that we feel we can cope with fairly comfortably. We could potentially go up to 3,000 should we need to. And I think the whole structure that we're planning is looking at the next 6 months. We want to have sustainable solutions. And at the same time, within our planning, we're considering our winter planning. So we need to consider that. We're considering our seasonal flu immunisation programme, and we're considering our COVID immunisation programme. So when we plan any programme, and this programme was planned to run alongside all of our other programmes. So when we look at the sustainability and the resilience, we don't just go for one programme, we look at all the programmes to make sure that we can deliver on all of those. Because delivering on a combination of flu and COVID-19 vaccine is going to be challenging in itself.
Do you think you'll be asking islanders to maybe step forward a bit earlier this year for flu vaccinations or the like?
Yes, so we haven't got a precise date for delivery for our flu vaccine, but we certainly want to ask people to be immunised as early as possible for flu, so that if we do get a COVID vaccine, it's by no means a certainty at the moment, we'd then be ready to look at delivering a second wave of immunisation, and the COVID vaccine might indeed be 2 doses of vaccine. So we're looking at a very complex next 3 months. So we've got massive planning spreadsheets and everything that we're planning, not only the vaccines, but our winter planning, looking at our winter hospital capacity, looking at delivering at the port. So we've got some major work streams, and we're trying to balance all of those so that we can deliver on all of those.
Just going back to your previous question about testing capacity, clearly, as Nikki said, we're looking at a window of around about 6 months. Now, clearly, if we have to live with COVID for longer than that, but again, depending on developments of vaccines and so on, then we'll need to think again about whether that's the right regime, whether we need more capacity, and if so, what that looks like and what the implications of that are. So I think it's appropriate to emphasise that the point is, do we believe that 2,000 a day is enough for the next 6 months, bearing in mind the time of year, bearing in mind travel patterns, students moving, all of those things? Yes, we do. Beyond that, there will be some further decisions required, but that again will be impacted by other factors, including the prevalence of the course of the virus outside the island, and of course whether the vaccine is developed. Okay, I think. Sorry.
I'll just add to that. When it comes to the flu vaccine, we'll be encouraging as many people as possible to get flu vaccine this year. I suspect there'll be a lot more people who probably want to have it this year, but we've been planning that. From Committee for Health and Social Care discussed this at their meeting on Wednesday. A lot of work's been going on about how we promote it, the work that to make sure people know what to do, how we can make sure we stop the barriers from people actually going and getting that vaccine, but in many different areas, so as we can do more than we would normally do in a year.
Okay, thank you. Final question, Helen.
Just staying on the subject of the flu vaccine, and just with the flu symptoms and COVID symptoms being so similar, are you concerned about sort of flu people almost overwhelming your COVID testing programme? So is there a case, I mean, you talked about promoting the flu vaccine, but is there a case for making flu jabs free for everyone, or at least extending the groups that currently have had it free?
Yeah, can I just start on that, and I'll be happy to move for you, Nikki. Yeah, I mean, in terms of cost, well, the State of Guernsey don't actually charge the flu vaccine. It's how it's administered, the charges for the administration of that. That is what we're looking at the moment, how that can be done more effectively and possibly cheaper. We're looking about whether that could be free or whether we have a reduced cost. So that's, again, that was something that we have already discussed. And I'll move to you, Nikki.
And then with regard to the diagnostic capability, you're absolutely right to bring that up, which is why we're looking at this process called multiplexing, where we want to put in our flu probes into the same assay as our COVID, and so it signals up and you look at the probe-specific analysis of seeing which virus it is. So it's then one sample. So our next piece of work is to look at how we can, we first of all enhanced our diagnostic capability, but now how we can expand it with regard to the viruses that we detect. And we always want more, so we're always pushing to move it on further. And I think that's going to be really important, because not only then do we have enhanced flu immunisation, but we also have enhanced diagnostic capacity for people with respiratory symptoms.
Your question about charging is also to some extent linked to the previous question on charging for tests as well. It's the same set of challenges and decisions that government has to make in terms of, as how you referred to, to government policy and direction on this, is thinking about the benefit that's accrued by a particular service, and therefore who should actually carry the cost of that. And as we think about the impact of flu on the community this year in particular, with COVID in the background for exactly the reason you've asked the question, that may change the dynamic about where the cost burden should sit, which is exactly driving why HSC have been thinking in the way they have, and whether there is a different way to do it this year. So there's still more thinking to be done, again, more decisions to be made, but it's another side of the same coin, really, about thinking about where the costs and benefits sit. And how you share that.
I should add that we have been talking with the GP practices as well about this, and about how we can, the barriers, because there are legal barriers in some areas, about how we can get the flu vaccine out there in larger quantities than we are at the moment in terms of who can administer it in different places. So we're looking at that as well, and so that dialogue is happening. Everybody is working together, and that work continues. I think that's really important to understand. You know, nobody's sitting back now. There's so much work that still needs to be done.
Good. Well, with that, we'll bring this to a close. As we said at the beginning, we do not plan to have, and it's worth repeating, we do not plan to have another press briefing before the general election on October the 7th. So no news is good news, so in the nicest possible way. We hope there is no good reason for us to see you again before the general election. So thank you very much indeed. Thank you.